just got off the phone with Judy Albert.
Okay.
She was having trouble getting on.
So let's wait for Judy.
And I'm letting 4 more people in now. So yes, I believe we have enough people to get started, but we could wait for Judy. Should take her just a moment.
Okay. Welcome, everybody. We're going to wait a couple more minutes and then we'll begin.
We are now live streaming to YouTube. Judy's joining now.
All right. Welcome. Welcome, welcome. I'd like to call the meeting to order. At what time, Veronica? I just lost it on my PC.
1:37.
Okay, we'll get started at 1:37 and we'll begin by asking Veronica to take roll.
Okay, I'm admitting 2 more people right now.
Yay.
So I'll go ahead and get started. Sorry, my computer's being really silly. I'm having to organize things a little differently. Okay. When I call your name, please let me know that you're here. Please remember to unmute your phone. Roseanne Ibarra. Having trouble seeing my screen. I'm not hearing anything from her, so I'm going to say Roseanne is absent. Lisa Judd shared with me that she is not going to make it today. Judy Albert. Jacqueline Williams. I'm sorry. Jacqueline Williams.
Here.
Jack is here. Wynn Novotny.
Here.
Grace Peeler-Stankiewicz.
I'm here.
Paul Davis.
Here.
Hi, Paul.
Hi.
Karen Lovato.
Here, sorry.
No problem. Amanda Archer. I see you, Amanda.
Here.
Okay, there, now I can hear you. Judy Albert for reals this time.
Yes, here.
Dan McIntyre is absent.
Absent.
Captain Sean Kaiser. Do we have no Sean? Okay. Rachel McDavid.
Here.
Thank you. Sandra Stolfi. Not seeing. Are you there, Sandra? Okay. Saying Sandra's absent. Blythe Post.
Veronica, I thought I saw Sandra.
So did I.
Okay.
Blythe is here.
Okay, Blythe is here. Sandra, if at any point you are on the call and we're not acknowledging you, please just speak up whenever you can. Camille Schrader.
Yes, I'm here.
Luz Martinez. You guys are really quiet, but I heard ya. Xenia Levacho.
Here.
QB Anthony.
Loud enough for you?
Perfect. All right, we have 14 members present. We have a quorum.
Thank you. Veronica, did you receive any public comment other than mine?
No.
Okay. Then I'm going to start our meeting off by recognizing myself. I'd like to share some thoughts. I think something very important happened at our last COC meeting, and I want to thank Hugh once more for his willingness to share his observations and experiences with us. And I want to thank Luz for joining the board. The reason the COC board are required to include people with lived experience is the acknowledgement that the best solutions are co-developed by folks with a broad understanding of the complex social problems we're trying to resolve. As COC board members, we must consider that we're making decisions for individuals who are not adequately represented in leadership, and understand that our decisions could have a disparate impact on them. I've been thinking about how we can make sure this does not happen, and came across a good definition of racial equity provided by the COVID-19 homeless system. Many of you, no doubt, have this understanding, but some folks are using equity and equality interchangeably. And I think this definition may help us as we work together on our COC endeavors. Equity refers to proportional representation, whether by race, class, or gender, of opportunities in housing, healthcare, employment, and all indicators of living a healthy life. When talking about equity, it's helpful to distinguish it from equality. Equality is typically defined as treating everyone the same and giving everyone access to the same opportunities. The assumption is that everyone will benefit from the same services and supports. This isn't true. Some populations are situated differently because of historical and current discrimination against them. Equity addresses the differences. Equality is about the sameness. It focuses on making sure everyone gets the same thing. And equity is about fairness. It focuses on making sure each person gets what the person or population needs. And I'll ask Veronica just to include that definition in our minutes. As I wrap up, I would like to share Jackie's tip for the day. As a mediator, I've learned that adults don't like to be labeled as racist or sexist. Name calling shuts down conversations and creates defensiveness. But what has worked for me is to reframe that conversation. After we acknowledge racism is systemic in our society, as witnessed in healthcare, housing, and employment systems, we can ask ourselves, are we as the COC upholding or condoning a racist system? Or are we challenging a racist system? In other words, we may be disappointed with how some of the information we get from the state comes to us and some of the rules we have to abide by to qualify for those funds. Because remember, the state is usually about equality. And so this is just a way for us to identify opportunities that we as a COC may want to feed back to the powers that be when things are not as they should be. And then lastly, I know there are many tools available to us to assess racial equity. And I encourage us all to keep a lookout. We may find a tool we want to adopt. Or I also would encourage that if you and your companies or organizations doing this work and have a tool you'd like to share, I'd really, I think the COC would benefit from that. So that's the end of my public comment. So with no more public comment, let's move to the approval of the minutes. And I believe we have two of them, Veronica?
Yes, we have the May 18th COC
Right.
board meeting minutes. as well as the June 29th full COC board minute, full membership minutes.
Meeting. Right. So let's take the May 18th minutes first. And after giving yourself a moment to review, I would entertain a motion, or we would, love the feedback if there are things that we need to amend.
I think we need to entertain a motion, and then we can have a discussion, and then
Okay.
we vote.
Would anyone like to make a motion?
I make a motion to accept the minutes as written for May 18th, 2020.
Thank you. Wynn? Is there a second?
I second it.
Is that Blythe? Thank you.
Yes.
Thank you. So the next are the minutes from our full.
So Jackie,
Oh, now I have to ask.
I
her.
think we should do them individually. So can we do discussion now?
Okay.
on
let's
May
discuss
18th.
it on May 18th.
So Jackie, this is
Yes.
Camille.
Yeah,
I wasn't there on May 18th, so when it comes to the vote, I'll abstain, correct?
right.
Thank you.
That's what we typically do.
Okay.
Hear or see other comments?
Nope. I think we can go ahead and do a roll call.
Okay.
So please say yes, no, or abstain when I call your name. Sorry, I made a mistake on one of them. I'm gonna make sure I catch that now. Jackie, yes, no, or abstain.
Yes.
Wind,
Yes.
Grace,
Yes.
Paul,
Abstain.
Karen,
Yes.
Amanda,
Yes.
Judy,
Yes.
Rachel,
Abstain.
Blythe,
Yes.
change the font color. Camille,
Abstain.
Luz, I'm sorry, I couldn't hear you.
Abstain.
Abstain, got it. Xenia,
I don't believe I was there for the roll call because I'm looking at the minutes, so I abstain.
okay. And Q,
Sí, señora.
gracias. That is a total of 8. And that is that's half our quorum, except 1 over, so motion passes.
Okay. So now I would like to ask for a motion to approve the full membership meeting minutes dated June 29th. Please.
Anyone who is there?
I make a motion to accept the minutes as written for the June 29th full membership meeting.
Thank you, Wind. A second?
I second the motion.
Thank you.
And I just admitted Sandra.
Oh, good.
Hi everyone, sorry for the delay, but there were internet issues here.
We're happy to have you, Sandra. We're just now going to do a roll call vote on the minutes of the full membership meeting of June 29th.
Sandra, would you like to vote yes, no, or abstain on the June? Oh, wait, we haven't called roll call. Never mind.
No,
Never
we'll
mind.
do it.
We
Right,
won't, and we've already done the other one. Never mind.
right.
Sorry.
So we'll do this one.
So no discussion? We have a motion.
And you received a second.
Yes, Grace is the second. I think we can go ahead and do the vote.
I do too.
Okay, so by roll call, please say yes, no, or abstain when I call your name. Jackie,
Yes.
Wind,
Yes.
Grace,
Yes.
Paul,
Abstain?
Karen,
Yes.
Amanda, Judy,
Yes.
Rachel,
Yes.
Blythe,
Yes.
Camille,
Yes.
Luz,
Yes.
Xenia, I didn't hear you, Xenia.
Yes.
Thank you. And Q.
Sí, señora.
Thank you. We have more than a quorum. Motion passes.
Thank you. So now we're at the reports and presentations part of the agenda, and we're looking for updates from local jurisdictions. I know Megan's not here. I didn't see Tammy.
Nope.
You've been gone for a week. I think we're moving off that one.
I think you're right. I have been giving nothing to update on you guys on, so that's not already on the agenda.
Okay. I saw Shannon. So City of Ukiah, Shannon?
Thank you, Jackie. I'm here. I wish Captain Keyser was here. I don't really have a lot to add. I know that law enforcement in general is pretty overwhelmed with the early release of hundreds of prisoners. People are kind of going crazy under the shelter in place orders. And so there's been a significant uptick in pretty significant criminal activity, not necessarily related to homeless, but just across the board. So I just know that we're stretched pretty thin. I don't have a lot else to add. If anyone has any specific questions for the City of Ukiah, I'm happy to answer those, but otherwise I'll move over to the City of Ukiah here, or Fort Bragg.
Okay. Thank you, Shannon. City of Fort Bragg. Veronica, I didn't see Tabitha or Sarah log on.
I don't either. I have some random phone numbers that are on here. So there might be people that I'm not 100% sure who they are. Most of the time it's somebody who's on there and also is on their phone. But but no, I don't see her.
Okay. So in the interest of time, we're going to move on. Dan, there isn't a strategic planning report as Dan is away.
And the strategic planning committee will be meeting. I have the date. Give me just a moment. On next Tuesday, July 28th at 9 a.m. to discuss the strategic plan as well as current funding that is on the table that need to be explored.
Okay. And I didn't see Angelica.
I'm here, Jackie.
Oh, you are? Great.
I'm here by phone. Internet issues.
Okay, good. So Angelica, do you have a Shelter Solutions report?
I can give a quick update. We did have a meeting on, sorry, go ahead. Yep. Okay, so we had a meeting on Wednesday, July 15th, and we discussed two main items. And the first was a discussion around a year-round inland emergency shelter, mainly because the RCS to B2 winter shelter is scheduled or was scheduled to close shortly on August 1st. And it was just a kind of a check-into since last year, about this time in July, the committee had brought to the board a resolution, which was 715-19-1, and that resolution stated basically the COC's explicit support for a year-round shelter in the inland area. And so what we talked about is basically actions that the COC can take to actually realize a year-round inland shelter. Sorry, in my throat. And how to make a shelter sustainable for the time there is that need and there's performance. So what we talked about endgame with that was, I know Sage is going to have a presentation later on at this meeting about B2 and an update. So basically what we're proposing, or as part of Sage's presentation, I think, is going to be kind of an agreement or an MOU that would give B2, which is currently the only inland, well, not only, but the inland shelter in Mendocino County, and how an agreement between the COC and B2 can make it more a year-round shelter more viable in terms of the support, financial support that B2 it may want to try to obtain. So that's it for that. The other item that we discussed was kind of a broad subject, was the criminalization of homelessness. And we discussed basically what role the COC should take around rules, laws, or policies in Mendocino County that criminalize people that are unhoused. We had a big discussion about that, and we're going to bring forward more of a solid report on that going forward. But one of the things that I did just want to bring up now is one suggestion was it would be helpful, since we do have law enforcement represented on the board, to have maybe every other month, not just UPD, but other law enforcement in our jurisdictions kind of reporting on what kind of calls they're getting, you know, on a monthly basis with respect to the unhoused, and what is resulting from the citations, kind of give an idea as to, you know, what other resources besides law enforcement could be used as an intervention. So that's it. Our next meeting is August 24th at 10 a.m.
So
by Google Hangout.
And on the COVID operational calls, the Fort Bragg Police Department is usually there. The Sheriff's Department's usually there. And although we're to be, you know, our primary objective is the keeping up with the directives with regard to COVID, often the law enforcement is talking about that, as well as the impact on the unsheltered. So, you know, one of the things that occurred to me was we may want to just host a panel, because it's interesting how some of the problems are very similar. Some of them are very different in Fort Bragg than inland. And it would help the COC if we heard all of that at one time. So that's something that if you think that we don't benefit from that, I'm sure that's something Dan and I could pull up. You know, having a law enforcement panel discussion and hearing from what Shannon's shared is true. Their number one priority right now is probably not that, but I'm sure, you know, we could try and see if we couldn't pull a panel discussion together here. Okay. I think we're moving on to Sage about discharge planning and coordinated entry.
Hi.
So we've been meeting weekly with the Coordinated Entry Discharge Planning Committee and continuing to address the changes that we've made to our coordinated entry system to prioritize those most at risk for complications due to COVID-19. We've seen our Community Development Commission, the CDC's Permanent Supportive Housing Program, make a poll for clients using the new coordinated entry screening, and so the Coordinated Entry Committee is working with the CDC on making it as streamlined as possible, and so we're adjusting to the new process. And I imagine we're going to be continuing to make adjustments and as needed in response to making sure that we're really prioritizing and getting the folks who need it the most access to housing resources. Jackie, I just want to say thank you for your comment during public comment, and also say this conversation around racial equity and accessibility was started in the Coordinated Entry Committee last week. We had a conversation with the members of the committee. Just as a starting point, it was fairly loose around, is our coordinated entry system accessible in a way that addresses issues of equity and for people of any the races and languages and different cultural elements in our community. And we are going to be looking at data from our HMIS to see, look at what that picture may look like, and then be brainstorming and looking at practices from other communities that have been doing this work to see what we can improve or try.
Thank you, Sage. I appreciate that. When you look at our COVID infection numbers, it's disproportional in it. So that was a reminder to me too that we should probably start looking at. We may need to do outreach in a different way or do our services in a different way in the future. So thanks for that. Veronica, do you have a membership committee report?
I do. We haven't met since our last meeting. So nothing as far as what the committee has done as updates from the last month, but we do have a new member for our general membership. Her name is Josephine Loomis, but she goes by Josie. She is a community advocate for Coyote Valley Band of Pomo Indians through a Victims of Crime grant that they received. I believe her position is 2 years funded, but I'm not 100% sure. So I'm really excited to announce that we have another member. And last month we had our new member orientation and invitation drive. We got a lot of response from the public about wanting to know when the meetings are and to be informed of, when the agendas are sent out. But other than that, we only had, I think, one newer member. No, we had 4 people total on the Zoom. Camille joined us. Roseanne Ibarra joined us. Somebody else, I can't remember. Sorry, guys. But it went really well. And that's really all I have.
Thank you. So will Josie be joining us soon?
Well, Josie isn't a board member.
She's
a general
first. Yeah, so she will attend the first full membership meeting.
Yes.
Okay, got it. Gary, I saw you when you joined us. Do you have a HMIS report?
I do. We did meet this month. There were only 3 of us. It was a short notice about the Zoom meeting, but we were able to get together, talk a little bit about HMIS, and what I showed the other 2 members, how the coordinated entry by name list is created, and if there were any questions from those other 2 members, we worked them out and talked about it. So just through that Zoom meeting, we were bringing people more up to date. That's it.
Thank you.
Yep.
Veronica, do you have any reports from your ad hoc committee? I know Dan doesn't.
I'll just go over it really quick.
Okay.
The point in time count committee is on hiatus. Probably until the pandemic slows down and we're not all crazy, to write an executive summary. That's why it's still on the agenda and hasn't been disbanded yet. The HAP ad hoc committee hasn't met. The initial discussion regarding HAP funding use has been fielded to the strategic planning committee. So I'm thinking once the strategic planning committee has provided guidance on how the HAP funds could be, and ESG. So it's both ESG, coronavirus, CARES Act funding, as well as the HAP funding through the state. So hopefully once the strategic planning committee has a recommendation, they can re-meet to figure out how to actually get it out there. And then the 2020 ESG ad hoc committee finished its work and can be disbanded. I didn't add it to this month's agenda. I was on vacation all last week and didn't even think about it 2 weeks ago. So I'll make sure to add that to the next.
We'll take action next time.
Right. Yes.
Okay. Thank you for that. So Veronica, if I remember right, we were going to move to the RCS shelter presentation now.
Yes. Sage, I believe you can unmute at any point that you want, and I'm going to give you control over sharing. If I can push the right button.
All right. Let me make sure or see how I can best share my slideshow.
Okay.
All right. Oh, wait, no, that didn't do it. Hold on. Oops.
And anyone who struggles viewing the live stream, Sage's presentation is included in the packet I sent out earlier.
Okay, give me just one moment. I'm going to just see if I can do this.
I thought only the organizer could do it. That's very, oh, look, you can.
I gave her
There you
permission.
go.
I gave Sage permission.
Oh, okay. Veronica, you have the word done. Veronica, you have the word done across your whiteboard. I am impressed.
That's the ESG-CV packet.
All right, folks. Can you see the slideshow? Is that the only thing on the screen, or is there a bunch of other PowerPoint?
It's your view. It's not the presentation view.
How do I make it the presentation view?
Use your other screen. Share your, there you go. You got it.
Yeah.
Did I fix it?
Yep.
Veronica, what would I ever do without you? You are so fantastic. Okay. Sorry, I'm learning how to do this as we go, and I apologize. So, did that break it up? Yep, it did.
Yeah, but Sage, it's now back to the, there we go. There we go.
It's just not gonna help me do what I need. Okay, so I'm Sage Wolf. I'm the Homeless Services Manager at Building Bridges for Redwood Community Services. And I appreciate the opportunity to do this slideshow. That's amazing that it's doing subtitles.
I know.
I don't know if I did that or if somebody else did that. Hey, it's working though. I just want to give you guys a review of Building Bridges as a project, talk about how things have gone in the last year. I'm also here with Camille Sugar, of course, who's the RCS Director of Public Policy and Program Development. So just
hoping to get through this presentation pretty quickly to not bog you guys down with too much information. Want to share with you just what Building Bridges is as a project, as a homeless resource center. Look at the data from the last fiscal year, so that's July 2019 to June 2020. And then talk about our financial projection and what our budget looks like, what the costs of the project are. And then also want to talk about what we've learned so far in the last couple of years of building up to the project opening, and then what we've learned since it's opened. And lastly, talk about what sustaining the project looks like. So briefly about Building Bridges as a project. It's a homeless resource center based in Ukiah. It encompasses a number of different elements. So it primarily started with this inland winter shelter that is open from November to April. It's a nighttime shelter with 46 beds currently. We are working on expanding the capacity to get up to 60 beds. And we're also pursuing support and funding to keep it operating year round. We've prioritized those most vulnerable using a standardized screening similar to the coordinated entry screening. It actually pretty much duplicates the old coordinated entry screening using the VI SPDAT, the vulnerability index. And we serve adults and families with children older than 14 at the shelter at the Building Bridges facility. And then families with children, we serve by issuing hotel vouchers for short-term shelter, as well as referring those families to resources such as CalWorks and other short-term housing and long-term housing resources in the community. The other piece of the project, of course, is the day center, open year-round. It is open to the public. Currently, we are operating slightly adjusted, as we all are, protocols due to COVID-19 to increase safety, both at the nighttime shelter and at the day center. So limiting the number of people who can come inside, requiring facial coverings, doing extensive frequent cleanings, etc. The day center offers supportive services, referrals, linking people to ongoing mental health services, as well as substance abuse services, medical services to meet their health needs, employment, helping people get apply for their SSI, things like that. We also at the day center have washers and dryers and showers, computers for people to access to take care of business, and supportive services focused on housing. The housing resources that we have through Building Bridges are our rapid rehousing program, which is a short-term rental subsidy program, and for people who are literally homeless, meaning that they are on the streets or in not meant for human habitation, or there's a couple other elements that fall under the literally homeless definition. And then we also do a homeless prevention program that serves people who are at imminent risk of losing their housing. And we also have housing navigation services that are really focused on addressing barriers to housing. And then briefly on community engagement, we work with our guests to do volunteer work and contribute back to the community. So that is contributing back to the community here at Building Bridges. So we rely on our guests a lot to be full participants in this facility. So they do a lot of cleaning, peer support with each other, under support of the peer support counselors that are in the facility, as well as we do targeted and active trash pickup around the neighborhood. And we also engage them in peer-led groups where we are really working to develop them as leaders amongst themselves. Okay, so we built this program with the foundation of trauma-informed care, housing first, being low barrier, and progressive engagement. these are practices or models that are supported through the National Alliance on Ending Homelessness. They're supported through HUD, and we looked at how other navigation centers that are similar to Building Bridges, that have a shelter, nighttime shelter and day center component in them, and looked at how other agencies are doing these types of projects. And so what we found was trauma-informed care, housing first, low barrier, and progressive engagement were really the key points to consider. So trauma-informed care really talks about centering the person, meeting them where they're at in any particular moment, not trying to force things on them, but rather engage them in things that are going to address their barriers and their trauma. It's a lot of focus on relationship building and using relationship building as a way to build rapport and build trust with them, recognizing that the experience of being homeless itself is trauma, is traumatic. And before we can adequately address things like mental illness and substance abuse, we need to take into consideration the trauma that they've experienced in their lives. So just real briefly want to talk about low barrier. What low barrier for us means is that we do whatever we can to make the facility accessible to people however they show up and to accept them as they are, and also to operate with a high level of forgiveness. This doesn't mean that we're letting people get away with unsafe behavior. It does mean that we do experience conflict here. And we do have people who come to the facility who are actively in their addiction. They may be coming to the facility intoxicated or under the influence of any number of substances. And we do see a number of challenging behaviors due to that. And we have found that approaching them with this low barrier perspective of acceptance and working with them helps us to avoid conflict with them. And that when conflict does happen, they are more responsive because of the compassion and the patience and this level of forgiveness that no human is worth throwing away, that they are all deserving of help and assistance and have the right to access support. So we found that to be a successful tool with addressing conflict and incidents. So lastly, on progressive engagement, our goal with progressive engagement is only to offer the amount of support needed to address each person's situation. So we're not going to start off with each person coming into the center by throwing a ton of resources at them, so we're going to take time to assess what's going on with each individual and create individual plans that address their particular barriers to housing, and looks at what are their natural resources first, what have they tried, what's worked for them in the past. And what progressive engagement shows us is that the majority of people who are homeless are going to correct themselves, meaning that they aren't going to need this high level of permanent supportive housing assistance. And so we're going to start with this light touch, and then we build up to things like some short-term diversion assistance, to rapid rehousing assistance, to permanent supportive housing assistance only if it's necessary. So the main goal of Building Bridges is to connect people with stable housing. It's a housing-focused program that works in housing into as many conversations as we can. The outcome of that is to improve wellness for our guests. The other piece of the improving wellness for our guests is things like offering showers and laundry seems like such a simple kind of, it's just a thing that we do here. And I'm going to share with you in the data section in a minute or two about what showers and laundry, how many showers and laundry we've had, because it's quite a few. The feeling that a person has after they get out of a shower and have clean clothes versus when they first come in is huge. Just that alone, but the change that it makes to a person's life by being clean is really phenomenal and impactful. So not just on their sense of well-being in terms of like that particular moment, their mood, but having access to hygiene for health is really vital. So we, even through COVID-19, we've seen one of our main reason that our program is so essential during COVID-19 is that it provides our folks on the street with access to the things that they need to keep themselves cleaner and have a better chance of not contracting the virus. Our goal is also to improve wellness for the community. So by providing a place for people experiencing homelessness to go and get assistance, we're gonna, our goal is to see less people out on the street. Our goal is to see the folks out on the street being just in a better space of mind, that we're working with them to engage with the community in a more positive way. And then our other goal is to provide a safe place to rest, reconnect, heal, and transform. That by having that place to rest and having the supportive services wrapped around them, it's providing them with an opportunity to heal and reflect and feel cared for and be able to transform their lives. So Building Bridges is led by a community council. The community council was formed like a steering committee. So it's made up of stakeholders from multiple agencies, which is Redwood Community Services, HHSA, the City of Ukiah, service providers like Adventist Health, Manzanita, McCavan Legal Services. We also have representation from folks who utilize the center and neighboring businesses and property owner on the council. The council meets once a month right now via Zoom, and we are overdue for a meeting. It sometimes gets a little out of my radar to get it on the Zoom calendar. So the role of the community council or the steering committee is to look at what's happening with Building Bridges on a community level, both on like what's happening in the facility itself with the clients, what's happening on a community level, and how is Building Bridges being set up in a way to support what's happening in Ukiah and the inland area. So with that, I'm going to turn it over to Camille and have her talk about how we got here.
So there are many people on this call and on this Zoom who were very engaged in the process for how we got here. So in some ways, I'm kind of preaching to the choir. And then there are other new players, which is some of the reasons why we've come to the request that we have today. So originally, this was a tiny house village that was meant to support 50 self-contained community homeless guests on a tiny house project with a community center and just a small kind of project. We were looking at the property in the shelter area, shelter overlay. I think now Ford Street, if I am right, has that property, but ran into quite a bit of difficulty in getting that property secured. And in the meantime, the rules and codes and regulations around tiny houses changed dramatically, which made it extremely prohibitive for us to have a homeless community village that was made from tiny houses. It evolved in this tiny house village was the brainchild of not just Redwood, but the Board of Supervisors, specifically 2 Board of Supervisors, and the CEO's office was highly involved. The county leadership was highly involved before and during our current HHSA director's tenure, and the COC, that many of you knew what was occurring and were a part of numerous conversations. It evolved in ways that it wasn't the original plan around a community. We were going to have a community call every week, and we'd have law enforcement, and we'd have all the providers and sort of handle just a contained 50 homeless people. It wasn't a shelter. It wasn't open to all homeless as a resource for showers and resources and mental health services and all of those things. It was simply to address it for a self-contained 50 people. That changed over time to where it evolved to the place on State Street where the winter shelter had been run before us, and with RCS and our community partners, McCavan, Manzanita, the homeless services from the county, a variety of faith-based communities, and the Homeless Services Action Group, I think was the title, and Sage can correct me. So through that process, we were able to get capital funding through the CDBG, was the original document with the Tiny House Village supported. When all of the state rules changed around housing, that also got adjusted because it was in its beginning stages. Then we received a partnership health plan capital facilities grant to build out the shelter to support the 60, ultimately the 60 homeless people in a shelter environment, with the idea of transitional shelter housing, permanent supported housing. What the criteria will change over time, of the 33 units on that property. And HEAP came in, and many of you are recipients of the HEAP project, but that supported getting the Day Resource Center and shelter built. The hope and the goal is to have people enter into the shelter, they use the shelter, they access the Day Resource Center, they build out all of the ways in which Sage just spoke of, engagement, support making better decisions in their lives, accessing housing, accessing the AOD, alcohol, and mental health services, including and consider to explore such as employment services while we work with our community partners. And then they graduate into housing of some sorts, including single resident housing on that property, and then out into their lives. So that's the goal, is that it actually brings people from homelessness into safe, secure, and the capacity to hold on to long-term housing. As we all know, the longer you're homeless, the harder it is for you to hold on to your housing, even if you are able to obtain it. So the role of the county mental health system of care was significant, continues to be significant. You were leaders in the different committees, in the different conversations as this evolved to where it is today, and continue to be our first and foremost partner in looking at best practices and the agreements as it relates to how we operate the Day Resource Center and the shelter. Thank you. By the way, the little note on the bottom said, "Hey, Japanese," about my language. Yeah.
The subtitles are kind of distracting and entertaining to watch if
pretty funny. Okay.
They don't match. All right, so I'm gonna try not to get too bogged down in the data. It's something, I mean, I get really fascinated by the data, but other people may not be as interested in hearing every single number as I am. So I'm gonna try just to move through it and point out some things that I've noticed. Of course, the slides that Veronica sent out have all of the slide information. So if you guys wanna go back and look at anything deeper, it's just kind of interesting, I think. So the Day Resource Center opened on August 6th, 2019. So we're almost at our 1-year anniversary. So just keep in mind that the data on this slide is for 11 months of operating from August to June. We have confirmed that we served a total of 923 separate individuals during that time period. We averaged about 422 visits, or not visits, sorry, 422 separate individuals visiting the center each month. I mean, obviously people come month after month and keep visiting. We were really surprised by the size of, like, the number of people that have come and utilized the center. Oops, I didn't mean to skip ahead yet. I am going to talk about a little bit later in terms of what we learned, gathering data for day center guests as they They come in, sometimes they're just coming in for a minute, they sign in and they leave. Sometimes they come in and use the bathroom. Sometimes they come in and stay for a couple hours. It's challenging to get individual data on every single one of them. So knowing what each of those 923 people's housing situation looks like, whether they're sleeping on the street or if they're in hotels or if they're, sleeping on a friend's couch or what, we don't have enough data from that to accurately reflect the population. However, what I will say is that every single person who's come and utilized the center during this last year is either street level homeless or very insecurely housed with inadequate resources. So for the year, we had 29,746 confirmed visits. So this is just those people that we were able to get to sign in. This is not, there are people who come to the center who forget to sign in and we're not able to capture them. We're constantly trying to figure out how to better capture them. So as you see, for showers, we had a total of 11,608 showers for the year and a total of 8,220 loads of laundry done for guests. This average is about 25 loads of laundry a day and about 34 individual showers every day. So again, the thing with laundry and showers, it just seems like such a simple thing, but it really is such a difference in their health and wellness. For the Inland Winter Shelter, usually in previous years, we've only been open from November 1st of the year to the end of April. And so I was going to take this back and compare it to previous seasons, but the data included in this report is for November through the end of June. So it's 2 additional months. And it didn't seem right to compare it to previous years when it's a longer period. We had a total of 291 unduplicated guests utilize the overnight shelter during the period. The bulk of those were individual adults, and we had 16 households who were family with children. I don't have a number of actual, how many individuals were in the families with children, but I do know there were 16 households. The average length of stay for everybody who stayed at the shelter over the season was 53 nights. And we turned away an average of 7 people every night due to having no open beds. We did operate throughout the entire season at 100% capacity. So I'm really proud of my staff and of really doing the outreach to, when there was an open bed, finding somebody who could fill it and make sure that our beds were being utilized to benefit folks who didn't want to sleep on the street. We screened 378 separate individuals for the shelter over the period of the season, which means not everybody who wanted to stay at the shelter was able to come and actually stay. But 291 out of 378 people who were screened were able to access it. This is basic demographic information on the age breakdown and race, ethnicity, gender, and we're also collecting data on LGBTQ identity. The majority of our folks that we serve are between the really 35 to 54 range, but we do have a significant number of elders who utilize the space, and a handful of transitional age youth that came through the program. And we were able to get a number of those connected to the transition age youth resources we have in the community, like Youth Project and Stepping Stones. So this is just more information about how people are connected to health insurance. This is, again, based on the data we collected from the shelter guests. I'm going to quickly point out 90% of the shelter guests reported that they have health insurance, which is surprising to me and consistent with last year's data as well, that Our folks are connected to health insurance. They may not be connected to a primary care physician. And they are, I don't have the data here on the screen, but they are inadequately connected to food stamps. But they do seem to have health insurance. 81% of them reported having been arrested at some point in their life. And then of the 291 guests, 12 self-identified as veterans. These were not confirmed with the VA, but they identified themselves as veterans. There's a high rate of experience with domestic violence, though, so 56% reporting having had an experience with domestic violence at some point in their lives. And there were 10% of the guests who reported that they were currently fleeing domestic violence. With our folks that are fleeing domestic violence, we do work with Project Sanctuary to refer them to services as much as possible. And we work with the person staying at a congregate care shelter that's somewhat open to the public is not necessarily the safest place for someone who's fleeing domestic violence. And so we work with them as best we can to get them a safe place to be, but we also will accommodate them here if that's a last resort. For our disabilities, a large number of them report experiencing mental illness and chronic health conditions. We do believe that the self-reporting on alcohol and drug abuse really is underreported, pretty consistently underreported, that people will not self-identify as having substance abuse challenges or alcohol abuse challenges. But we did have 75% report that they live with a disability. So the folks that we're serving at the shelter really are the folks that they're people who've been homeless for a long period of time. They've been living with a disability. They have inadequate income or no income, and few resources. We do collect information to help us determine what their connections to Mendocino County are. And we identified that 83% of the guests at the shelter are directly connected to Mendocino County. So meaning that they have family in Mendocino County, they've grew up here, went to high school here, or they were employed or housed here prior to their experience with homelessness. 12% of that being families with children, and 71% being homegrown or local individuals. And then 5% of our guests were identified as being established in Mendocino County, but not having direct connectivity here. So meaning they didn't have family or housing or employment history here, but they don't appear to have connections outside of Mendocino County. So we're continuing to explore that with any of the guests that come through that that don't appear to have resources anywhere. A big part of diversion practices relate to family finding and mediation to help them reconnect with lost relationships. We did find that 13% of the guests that came and stayed at the shelter appear to be new to Mendocino County and not have direct connections here. Some of those folks were people from neighboring counties. The majority of them stayed at the shelter for fewer than 7 nights. So while they were 13% of the population who stayed at the shelter, very few of them stayed for any significant period of time. And then this little 1% up here of not homeless individuals, there were 3 people who came to stay at the shelter who on an emergency basis for just 1 to 2 nights because they got stranded in the county and needed assistance finding their way home. And they were all able to get, all 3 of them were able to get buses back home. So our exit data for the season, we had 15% or 36 of our guests who exited went to permanent housing. The majority of that was actually to rentals, to apartments of their own, either with a rental subsidy or without. And then some of them went to live with family and not just live on couches, but live as in actually like moving into a room of their own. 23 or 10% of the people exiting the shelter went to short-term housing. So couch surfing, living in a hotel, transitional housing, that sort of thing. And then there was 7% that left the shelter to go stay at another emergency shelter. This was the shelter guests that exited to the county's Project Roomkey hotel at the onset of COVID-19 epidemic. And then institutional settings, that 13, those are exits to places like jail or hospitalization or skilled nursing facilities. We had 13 people who we don't know where they went when they left. And I'm actually really excited about this number because it's very small. In previous years, we've had huge challenges figuring out where people go when they leave the shelter if they just disappear. And one of the benefits of having the day center is that they don't disappear as quickly. They maybe come back to the day center even after they've left the shelter, and we're able to do some more follow-up work with them and identify where they've gone after they left the shelter. That did mean that our places, that when people leaving to this or leaving to homelessness is at 57% of the guests left to the streets. I can say I'm very excited to see our housing outcomes and see us really improving on how many people we have exiting to housing rather than back to the streets, even though it's still smaller than the number going to the streets. So quickly on our housing programs, our rapid rehousing program, which is as I said earlier, a short-term rental subsidy program. It also does things like security deposits. It can pay for things like rental arrears if there's a client who owes rent and that's going to keep them from acquiring housing. In the fiscal year, so this is July 2019 to June 2020, we served 51 separate individuals in our rapid rehousing program. 25 of those were household, or 51 individuals in 25 separate households. 12 of those households were families with children. So 13 were individual adults, 12 with kids. Through the course of the year, 48 of the 51 individuals have now acquired and are sustaining permanent housing and rentals in the community. There are 3 individuals in one household who, at the end of the period, were still hunting for an apartment. And so our rapid rehousing program is also, it's rental subsidy, but it's also supportive services, which is housing navigation. And then once they're in a place, it's support, case management support to stabilize and maintain their housing. Our homelessness prevention program provide payments of back rent for 12 individuals in 6 separate households. 3 of those households were families with kids. And all 6 of those households were prevented from entering homelessness. Oh my gosh, okay. So just to give you an idea of what this project costs, the way that we've broken up our budget is by the expenses related to the day center. That's our year-round, daytime, 7 days a week program. Our expenses related to the nighttime shelter, which were previously budgeted as a 6-month shelter, and right now we're working at budgeting it for a year-round shelter. So those are all the expenses associated with the nighttime shelter. And then the third category is our housing assistance expenses. So that's our housing, our rapid rehousing program. That's the homelessness prevention program. It's a emergency assistance diversion fund, and it's our housing navigation staff services. So you can see the monthly amount, the annual amount for the day center. And I'm going to go into those in just a little bit more detail, but try not to get too bogged down here. The day center expenses, I've broken these up into our personnel expenses. So these are the direct cost for staff, averaging about $28,000 a month for our staff expenses for the day center. This covers staff, us having a minimum of 2 to 3 peer support counselors on the floor at any given time. We also are currently employing a LVN, a licensed vocational nurse case manager. This was identified at the onset of COVID-19 as being especially important to help mitigate the risks associated with COVID-19 and as we're providing care in a congregate setting. The guest expenses are for things like incentives, all of our supplies for the facility, for the day center. And there's also wraparound expenses included in here for direct client expenses associated with a Finding Home program. Finding Home is a program that is funded through a grant from SAMHSA through the county that assists people with co-occurring disorder, and it has a wraparound component to it. And then, of course, operating expenses are things like utilities for our showers and laundry, our mileage, facility costs, office materials, things like that. So as you can see, that the total cost for operating the day center looks like $461,700. We have secured funding sources for the day center through, as I said, SAMHSA, our grants for the benefit of homeless individuals. We also have funding for the day center through the MCHSCoC funding, and then we have funding for it through Mendocino County General Assistance. So these are the details about the inland shelter. This has been on this budget. It has been budgeted as a year-round shelter, but I do want to clarify that our previous funding that we had identified for the shelter and that we've currently secured for the shelter is to support it operating for the winter months. So we're continuing to pursue that funding to keep it open for the May through October months. So the personnel expenses you'll see here are the monthly amount average and then the annual amount for it to operate year round. This is to cover, again, a minimum of 3 staff to be on the floor supporting the guests at all times while the shelter is operating. It also supports a portion of that LVN case manager wages, and it supports our maintenance staff that come and take care of the facility. The guest expenses here, the guest expenses that you see here, the averaging $2,438 a month, the bulk of that is this is our hotel vouchers for families with kids, and then our supplies. And then, of course, our operating expenses. You'll see here we've got a secured funding or pending contracts of $244,400. And these come through the MCHSCoC. They come through the Mendocino County General Assistance contract. We get some funding through Whole Person Care, through the Mental Health Service Act, and then a lot through donations. Well, not a lot. We try to get a lot through donations. And then our housing assistance program, this is our rapid rehousing, pays for our housing. This program is pretty much close to funded. It's got a difference of $49 in between the funding we have secured for it. And I will say given the amount of this budget, the 302, this is about twice as much funding as we had in the previous year for our rapid rehousing and homeless prevention costs, because we have additional contract with the County of Mendocino CalWorks program to provide housing navigation services. And I'm really excited to see what this is going to mean for our rapid rehousing program, because in the last year where we had half this amount of money to support the rapid rehousing program, we were able to house 48 individuals or 24 households with that amount of funding. And so with almost double that, I'm really excited to see how many more households we can support with it. All right. I want to talk a little bit about what we've learned through the project.
Hey, it's Jackie with a quick question.
Yeah.
So before you get there, I'm stuck on the folks that don't have medical insurance. And I'm wondering, those the folks that perhaps don't have a green card or are here and are undocumented?
It's possible that that makes up a couple of them. So 10% would be of 291, 29 people.
Yeah.
So a couple of them might be folks that don't have documentation. And then I think for sure people who just have not been connected historically, like they are just lost.
So our local clinic has a grant for that one particular case.
Oh.
Yeah, so let me, and Xenia probably knows this better than I, but let me reach out and see if there's probably some information.
Are you talking about CMSP?
Yes.
Yes, I have something that's coming down the tube for that.
Okay, great. So, it's probably not all of it, but a little more help there.
Yeah.
Okay, thanks, Sage.
Yeah, I am. So I was gonna start with relationships with clients, but I'll start with relationships with partners. In terms of things we've learned, man, having medical services in building bridges has been huge. And we really felt it when COVID started, because we were having Hillside Health Clinic was coming in and doing every Tuesday morning, they came in for 3 hours with a couple of the nurses from Hillside and did a clinic. And then every Thursday, Adventist Health Street Medicine program was coming in and doing a clinic. And they did that really starting back in August when the center opened, up until March when the epidemic started or hit us. And having medical folks come to the center and provide services here has been just such a phenomenal assistance for folks that we have a lot of people who want to go to the emergency room and they want us to call an ambulance for them. And if we can instead say, let's talk about what's going on, and can you maybe hold off until street medicine is here on Thursday, or can we call the street medicine team and see if there's a way to get somebody here earlier if it's more of an emergency. So doing that rather than bogging down the emergency room for things that really are not necessary, they're not an emergency. But for our folks on the street who, making a doctor's appointment and keeping it, like there's all sorts of barriers to like making an appointment and going somewhere. So having that on the ground here at B2 really is such a benefit to our folks in improving their lives. And when COVID started, it kind of died for a second. There was a minute where like Adventist Health was trying to figure out how it was operating and the clinic was figuring out how it was operating. I mean, we all were, right? And so now we have Adventist Health is coming for 4 hours a week, and they are not just a nurse case manager team anymore, which is what was coming previously, but one of the Adventist Health doctors is coming and so they have doctors that are doing rotation.
So Sage, it looks like Q has a question or a comment.
Yeah.
I don't know if we're waiting till the end or.
I was waiting till the end. It's okay.
Yeah.
Q, I can't hear you.
We have to unmute him.
We really can't hear you. You look like you're unmuted, but it's not working. Uh-oh.
We see you talking, Q.
I don't know how to fix it. I'm going to move forward. Veronica, can you maybe help him fix it? Okay. So our relationships with our community partners. So building bridges, it's, RCS is the operator. Camille's going to talk a little bit more about this in a second, but RCS is the operator, but this facility is really meant to be driven by the whole community of partners that work with it. So really maintaining that relationship with our partners, so Manzanita and McCabe, and our relationship with how we do referrals to Ford Street and how we do referrals to the county's SUDT program, and all of that is so important. And then the relationships with the guests that we serve, there's a lot of folks who are really disenfranchised. They're very they are disconnected. They've been homeless. They've been living on the street for a long time. As I said, experiencing a lot of trauma. And just building a relationship with them has been so significant to being able to engage them in their own lives, and show that they really have the power to do something within themselves to make improvements as they want to. This also talks like, so when I think of building relationships with the guests, it's also about like, there's so much of a power differential automatically in a program where you have staff and you have guests, and staff are authority and the guests like have to do as they say, and like and programs can get very rule focused. And so what we've been working to instill in this program is that we're all here working towards goals together, that each person has to be individually accountable for their own lives and their own choices and the consequences of those choices. So we don't try to protect people from the consequences of their choices. And we try to work with them that when there's conflict or problems with guests that impact the rest of the guests here, so when there's a real safety issue of aggression or violence or substance abuse that has really had an unsafe negative impact on the rest of the guests, we really work with the guests in having utilizing a transformative justice model that is peer led. So having the group of people who utilize this space involved in what does it look like for that person who may have harmed people here to re-engage with the community? What kind of restorative practice they need to go through to re-engage and be able to utilize the center safely? We found that to be more effective in terms of holding people accountable than having staff in a position of holding, you know, an authoritative line with rules and such, but rather having a community-based set of code of conduct that they're holding each other to. So the other thing that we've learned is having employees who really get the process that we're trying to, like the vision, the values, the foundational practice of low barrier, and again, that, you know, low barrier meaning like meeting people where they're at, accepting them, while also being able to help people be safe and addressing unsafe behaviors while accepting and loving the person. We have, you know, employees that, so we've set up our interviews to really look at how we ask our questions and interviews to find people who can really buy into the model that we're doing. And those team members are just phenomenal. And what I've seen it through, it's been very challenging at times, even before COVID-19, but since COVID-19 started, it has been even more challenging at times to be working at the Homeless Resource Center. And the team of staff we have here are amazing human beings who are just continuing to show up every day with their full hearts and really active, trying to use the skills that they've learned, but also just try to engage with the people that we're serving.
Can you hear me now?
Oh, I can hear you now.
Cool, man. Sorry about that before. If you don't mind me asking you a quick question real quick.
Go ahead.
It's kind of related to the doctors and nurses coming to the shelter. With COVID-19, I know because I show up and have friends who shelter, even through them, that you have tested your clients who are currently staying at the shelter for COVID-19. My question is, are you being able to also, for those who are wanting COVID-19 who are outside of the shelter, to be able to come in and be tested as well?
You were breaking up just a little bit. So I think you're asking that about our testing that we did for shelter guests, and also asking if we have been able to do testing for folks living on the street, not staying at the shelter.
That is correct.
Okay.
Sorry
So
for the breakup.
we did have public health came and did a round of testing. I want to say in April, maybe May, that they came and did a round of testing here. It wasn't people at that point. I don't think that it had really hit the streets yet, and why it was important to get tested and what kind of a risk COVID-19 is. So we didn't have a great output. Anyway, we didn't have a lot of people get tested that first round. We did have public health come and do testing in about 2 weeks ago for shelter guests and for the staff working at Building Bridges, and of which, so they did 57 tests and they all came back negative. Very exciting, very happy to have negative results, at least for that moment. And in terms of, I do think having public health do another round of testing for folks, either at Building Bridges or at Plowshares, where people frequent, would be an amazing thing to have happen.
That's why I asked, because I know that because of it being not only a high traffic area, but like we're up to 193, if I remember correctly from the numbers of last checking myself, of cases reported here in Mendocino County. We're, unfortunately, once it does hit one of our unhoused populations, it's going to spread not only because of our unhoused population, but massively across everywhere else in our community. Unfortunately, that's what I foresee. And I'm, in my hindsight being 2020, I'm actually asking that because of trying to make sure that we're nipped in the bud before it even happens.
Thank you, Q. Okay, I'm going to go ahead and move through the rest of this pretty quickly, because I know we have 2 more slides left and then we'll be done. And I know we're going to be way over time. I appreciate the time, though. We've learned a lot about data. Data has always been a thing that's very important to me, but it's very challenging to do well when you don't have adequate systems in place. And so we had a lot of barriers starting out to collecting data, to compiling it, and we've been able to work through a lot of those challenges. We now have a full-time data analyst, so for the volume of people that we see here, having that person who's dedicated to collecting the data, compiling it, putting it into our homeless, our HMIS database, being able to run reports has been really a significant portion for us to be able to have good, reliable, accurate data to look at and learn from. We've been able to use the data we've compiled so far. So for example, not just the data that we've compiled internally, but we've been working with the Ukiah Police Department to get reports regularly on the kinds of calls to law enforcement for assistance that come for Building Bridges. And so we get reports and are able to look at that, and compiled a report from the previous year of when calls were made, like what time of day and what days of the week and what times of calls. And we were able to use that information to look at like when's our high points of conflict and need for police intervention, and look at what's happening, where are the times low, where are they high, how can we use that information to like identify what is happening that might be different that we can replicate during times where calls to law enforcement are low, and what are times of the week that we maybe need to have additional supports in place to reduce our calls to law enforcement. And through that, we've been able to significantly reduce our utilization of law enforcement. And I hope to, at a future presentation, be able to report on those numbers. So just talking about diving in, that what we found, we did a lot of planning before this project started. We worked with a lot of community partners. We worked with the COC, and we put a lot of pieces in place and did research, talked to experts from other communities, talked to people who had, or other agencies and communities who had implemented things like a homeless resource center, navigation center type facility, and we didn't have all the pieces put in place before we opened. And at some point we just said, we have to dive in. We kind of hit a deadline where it was like, we just have to open the facility and get it going and start to learn what this looks like to actually operate it on the ground and take it from being this kind of theoretical project idea with a very thorough plan and all that to like actually operating it. And so, I think that's the case with probably any project that you work on, that the best laid plans, and then you put it into place and you go, well, that thing doesn't work and we've got to try something else, or we have to adjust. And so we've, continued to adjust how we operate, how policies are set up, how we utilize the employees that we have. Maybe there's positions or things that need to be done differently, et cetera, to respond to the need of the facility and the needs of the guest. And so, we work with our steering committee or our community council on making big changes to the project. And this is kind of leading up to our conversation about sustainability and some of those pieces that maybe we could have put in place before the project opened, but because we just needed to dive in and start, we maybe overlooked. So I'm going to let Camille go ahead and talk about sustaining this project.
Okay, almost last slide. So this is a pretty important thing that we have learned in retrospect. I think Jackie Williams probably could have told us to do this ahead of time and told us this should be a non-starter, but we didn't ask. We didn't ask. So, back to my original slide that I explained, this was a community project. We did not, RCS did not say, golly gee, let's go apply for a CDBG grant and start a homeless shelter all on our own. This was done at the first request to several board members and in collaboration with the CEO and the county HHSA. It then moved, and those have had a variety of different players in it, Supervisor McCowan being the most consistent, strongest one from the beginning. Carmel Angelo certainly was one of the champions of it. And all of the nonprofits who we consider our strongest partners, the Project Sanctuary, McCavan, Manzanita, Ford Street, the COC, the Homeless Action Group, and the Hospitality Center on the Coast, like tremendous amount of involvement in deciding, all right, well, if not us, who, if not now, when we launch this. In all of those conversations with the city, with the county, with was we don't want to be in a situation that Ford Street ended up in, where we build it and we cannot sustain it. And it was never, and I'll use the words I quoted back when we were talking about this, I don't want to have to go beg for funding to sustain a project that we all were committed to. So roll up, I don't know, 3 years, 4 years, and some of the players have changed and some of the situations have changed. And as we all know, COVID-19 is going to take us into a situation that is unprecedented. And what we probably should have done, having learned from other people, is to have had a written MOU from the COC was very involved and is very committed. And this is not to say anything about what the COC has done wrong, because you've done nothing wrong. This is trying to preempt and be proactive into the future. What we are asking for is a clear recognition that this has been a project sponsored by the community, for the community, with the community COC involvement, and that as new projects come on board, that absolutely is appropriate. There's nothing wrong with that. But in order for, especially for projects as extensive as building bridges, it was an investment made by the community through CDBG, HEAP, and PHC funds, and sustaining it is up to us. The MOU with the COC would help by solidifying that relationship that B2 has with the community and with everyone on this group. It would make us feel like that within the context of, as funding comes down, that something we thought of 5 years ago continues to be a primary part of what we were looking at to continue ongoing sustainability as new opportunities, new partnerships, and new expanded services and supports become available for our homeless population. So that's the point, is to just be transparent, to be clear, to be direct, and to try to avoid, it is not the COC's responsibility to be 100% financially responsible. It is not necessarily the county's 100%, but it is all of our responsibility to a certain degree, because that was the commitment. And it's important that we not redo history. So what we're asking for officially, and Sage can formalize this language to the COC, but we are requesting that the COC consider formalizing the partnership between Building Bridges and the COC. The COC can build upon the letter of support that you wrote for the project back in 2015. In the MOU, we would request that language be included to demonstrate how B2 is sponsored and supported by the COC. We're not asking for a guarantee of any specific level of funding through that sponsorship. Through this MOU, we expect Building Bridges to be deeply transparent and accountable to the COC and to the community. It could even require that Building Bridges Community Council be incorporated as a standing committee of the COC. We want this project to be one that is driven by the community, even as individual leadership within RCS, within the COC, within the county, within the city, within the community at large, all of those partners changes. The people move, the commitment stands, is the request. So I thank you very much for hearing us. Again, I want to reiterate, there isn't something wrong. We are trying to prevent anything from becoming difficult in the future. So thank you so much for the time that you took. And Sage, you did a very good job showing what B2 has done and the work that I hope is considered valuable by this group.
All right, so next to last slide. Our biggest priority right now is the winter shelter and keeping it open. I talked about the funding, what it looks like to operate the shelter. It's about $47,000 a month to operate the nighttime portion of Building Bridges. We were able to acquire funding thanks to to Mendocino County Health and Human Services, and thanks to really RCS for 3 months worth of operations for May, June, and July, that we were able to figure out how to raise $150,000 for operating the winter shelter for those 3 additional months. And now we have August, September, and October to figure out how to fund and keep open. So we're launching a fundraiser. I'm going to be posting it to social media either tonight or tomorrow morning. There's a GoFundMe associated with the fundraiser, so people can do donations online. That GoFundMe is not live yet, so if you click on that link right now or anytime tonight, it will not be live. You'll get sent to a not real page. Oh my goodness, there was. I'm getting feedback. Sorry. I'm going to ignore it, even though So
Sorry to interrupt, Paige. If you're not speaking, could you go on mute? It's somebody's microphone repeating it.
Oh. Woohoo. Yay, thank you, Veronica. But so anyway, the GoFundMe page will be going live tonight, and we'll be posting it to social media. I really would ask that everybody who can blast it out to whoever you can. Our goal really is to raise $150,000 to keep the nighttime portion of the shelter open through November, when November is when the regular winter shelter season starts, and we have other secured funding sources. So we have kind of steps along the way of, for every $50,000 that we raise, that's 1 more month of operations. So if we raise $50,000, we'll stay open for August. If we raise 100, that's August and September, etc. And we're looking for individual and corporate donations, but we're also exploring grants. I mean, we're exploring grants through the COC, we're exploring grants through the County of Mendocino, through the state, and really anything that's available to support the shelter operating. we'd also love to find some ongoing sponsorships of people, donors in the community who might want to set up a reoccurring donation. Any questions or anything can be directed to RCS's Public Relations Officer, Angie Baker, and her phone number is on the flyer. Or of course, you can email me. And that is all. We're really grateful for being able to do what we do. Building Bridges has been an amazing project so far. I'm incredibly thrilled to be part of the team and really honored to be on the team. And if any of you are interested in, right now is not a time to come and get a tour. I would love to say that it is, but nothing is happening in person if it doesn't have to, right now. But if you have any questions about Building Bridges or just want to know more about it, I welcome calls.
Thank you, Sage. The ask for the MOU is something that I think the board needs to discuss, and it may set a precedent for us, to look at other what we would consider core programs and how they align with the priorities we've described in our strategic plan. So I think this is a really good opportunity for us to kind of look at those things and see if we can't strike a sense of priority and then look at what those, what an MOU might look like. It's, I remind you guys, the COC is not the county, and some of the county's funding, you might end up with a MOU from the county and an MOU from the COC, or maybe we'll blend them together. I don't know, but I think we're going to have to think this one through and come back with a proposal at the next meeting, if that's okay. And I'm sure we'll be in touch with Camille and Sage with our questions. Other board members have input or suggestions for me before we move on that one?
Actually, I did, but I see Winhead would beat me to it.
No, go ahead. Go ahead.
Ladies first.
I was just curious, Jackie, if you were bringing that to the strategic planning agenda then for the committee at the end of the month.
Dan, I think that would be Dan's suggestion, Wind. I think that's a really good idea. He's just not here, and I hated to commit him without him being here to defend himself.
Thank you.
Good idea.
Well, personally, me, first off, I want to go back for a second. Sage, Wolf, Jackie, Veronica, Xenia, thank you for, thank you. Just simple as that. Because it was a lot of hard, and even so, like, me speaking out, it was hard. Anyway, going back to everything with Sage, I believe that, like what you were saying, both you and Camille were 100% correct. Even Camille, when you came in at the end, there are certain things that you're right. We need, as the COC, to back a shelter, so to speak. We also, that's my personal opinion in my personal way. Also, in my personal opinion, we also need to be backing multiple different shelters personally, because I know from my own personal experience as somebody who was unhoused, when I can't go to say, and I'm having issues, even in my own personal life, a couple of years back when I was staying at the shelter, my own personal life had conflicts because my partner was staying at the shelter. So I had to go out to Fort Bragg in order for me to like separate myself from my partner so that like, one, my heart can heal. Two, there was no domestic violence. In certain aspects of that, we need to like have multiple different places like that. That's my opinion, and I'm sticking to it. But thank you all.
Thank you, Q.
Jackie,
Yeah.
I would also like to say, I agree with you that the COC is independent and separate from the county. Q, by the way, you have been an incredible example of why it is important to have emergency shelters and why it is important to care about our homeless population as human beings and try to move forward wherever they are. So, Jackie, I just want to say, I know that, I appreciate that. This same kind of conversation needs to happen at the county level. You know, it did not, I don't know why it did not. I should have learned your lesson. Occurred to me that, you know, Board of Supervisors change and things change and leaders of organizations change, both our nonprofits, our county leadership, our COC leadership. And if we build things and then we forget because of the new thing coming forward, which of course is great, right? Nobody's saying don't do that. We're just saying as a part of the strategic plan, we need to anchor those because the anxiety is so pressure cooking that we can't actually pay attention to the clients we're supposed to serve because we don't know where we're going to find our next dime. And I didn't build Redwood on that platform. It's new to me to feel this way in this kind of a way that's completely out of our control in terms of homeless services. So I really appreciate the time and the understanding, and I agree with you. It's something that needs to happen, not just for building bridges, which is our ask today, but in general as a protocol moving forward. So thank you so much.
Thank you, Camille.
Judy, I had a comment.
Yes. Did
Judy,
somebody else have a comment?
I remembered something else I wanted to say if I can have this second.
Sure.
So the other thing about that, Camille just reminded me of this, the anxiety of like, where's our funding coming from? And are we going to be able to find funding to have a year-round shelter and operating a 6-month winter shelter, as well as like being able to cultivate having staff who are really dedicated and have a skill set that having a skill set and level of professionalism and self-awareness and to be able to adequately address the kinds of challenges that come up at the shelter. Having it be that it's a 6-month shelter and people, and like we might be able to stay open another month, maybe there's a job insecurity thing that has consistently happened with the winter shelter that is not sustainable in terms of being able to acquire the level of skill staff that we need for this facility. And so there's a definite need for a year-round shelter, both but for just purely because we have guests who need shelter, but then really because in order to acquire and sustain and keep the staff that make this thing what it is, we can't have them continue to be in this state of job insecurity and anxiety constantly. Or if we do, it needs to be in a really careful way. So that's just
I think this is one of the things, Sage, that all of us who are in the human service field realize that our agencies don't exist without the people that have the skills and compassion to deliver the goods.
Yeah.
So I see that your staffing is a part of the sustainability play that Camille's trying to help you nail. So all of us I think most of the folks on this call really understand that. So other comments before we move on?
Just a big thank you. Thank you.
Thanks, Wind. So Veronica, I see that we have some funding things listed here, but it doesn't look like there's many updates. Are you aware of what we need to review?
It's just a couple updates that I wanted to provide to the board. One is that both applications for ESG, the 2020 Balance of State, our regular round, our NOFA, and our ESG CARES Act applications have been submitted. They were submitted prior to the deadlines. And I've had a little bit of follow-up from one of our ESG HCD reps, just clarifying a question on the coastal application. And so it's great. we just kind of wait and see. With the coronavirus funding, it's an allocation, not a like a competitive grant that we have to compete for. So that amount will be awarded, allocated to us. They just have to do the paperwork. And do you want to open it up for discussion before I go on to the other one, or
Why
can I
don't
move
you,
on?
because we're running out of time, why don't you do
Okay.
one and then we'll let people ask you, should they need clarification?
And then the other update is regarding HAP, the Homeless Housing Assistance Program through the state. And when I wrote this, our allocations and agreement from the state had been received. And then today we got the scans back of the state signed agreement. So everything is in place for HAP.
Okay. So questions or clarifications needed from Veronica from the board?
And it can be more than just ESG and HAP. It can be any of these funding sources. Those are
Any
just the
funding.
only updates I had.
Right.
Veronica, this is Sage. Do you know if the state has confirmed did they confirm receiving the ESG balance of state applications?
No, what I received was, I got an email from Diona saying that the MCHC's like Form 1, the contact information was missing. And then the stick we sent was blank because we were doing multiples and it was stupid. But we got them the information they needed. So they didn't provide any confirmation. I sent ours via like certified mail and they had to sign that they got it. That's the only confirmation I got that they got it.
I know that we sent ours in time and they for sure got it in time. Anyway, due dates makes me anxious.
Yeah, they'll actually respond to you directly with that, not to me.
Okay.
Anything else? Cute.
I do have a quick question. I'm not quite sure if it's encompassed in all the financial questions, but like one of the questions that I do have actually kind of encompasses Manzanita and RCS as well as HH House, because the question I have actually involves the navigator with the funding. Because I actually have a suggestion that I'll later date with both Sage, Wolf, as well as what's the name from HH House. Anywho, is there being funding coming in for like navigators through any of the fundings? Like
housing navigation is considered a type of case management. And as long as it's provided to people who are experiencing homelessness, like through street level or through emergency shelter, it's an eligible activity through ESG. I know that we could probably get some funding through HAP, use some of the HAP funding for that. CHSCoC, I believe, is already being used for some housing navigation actively. Yeah. And then some of the other projects, it's just not in the legislation to allow it. It's not an eligible expense. So it is going on. And there's additional funding than what you see here that supports the housing navigation, but it varies by agency.
Gotcha. I'm sorry. Still dealing with my own personal issues. I didn't make the couple of the meetings that I wanted to make, so I was just trying to encompass everything.
Yeah, and we can talk more about that offline if you'd like.
Appreciate it.
Okay, now's the time if any of the members of the board have announcements. This would be a good time to make them.
I have an announcement.
Yes.
Hello? So the Board of Supervisors tomorrow is going to be having a workshop with the Latinx community It'll be on YouTube, the Mendocino County YouTube, from 3:30 to 5:30.
Thank you, Xenia. Other announcements? Okay, our next meeting is Monday, August 17th. And I won my bet with Dan that I could end this meeting on time. Dan accused me of talking too much. So yay. Thanks so much, everybody.
Good job.
Thank you.
Good job, Jackie.
Thank you, everybody.
Yeah.
Bye, everyone. Be safe.
Thank
Be
you.
blessed,
Bye-bye.
everyone.